Dr. Ford checking in. Now, we have a lot of ground to cover. We have a lot of really valuable information to go over. Let's dive right into it. But first, let's take a minute to acknowledge where we've been, where we are tonight, and where we're going. So last week was a tough week, right? I touched on that in my last video. And if you want to kind of dive into some more detail on that, please take a look at the last video. And look, I just want to say this. I recognize, I feel it myself. I realize I've heard from you. I've heard from strangers, friends, family, and patients. It was a tough week. It's heavy. The isolation, the quarantine, things being shut down and things being totally abnormal. It's really starting to set in. We're starting to feel it. My last video really talks about how we can confront that and kind of grab the bull by the horns, if you will, and take control of your situation instead of worrying about things that you have no control over. So if you're interested in more of that, check out my last video and send out any questions or comments. And on that note, thank you guys. You're keeping me very busy, but I feel very grateful, very blessed to be in a position to be able to help in any way I can. So again, thank you very much for relying on me for some of your personal and very important questions and comments. So where are we tonight? Look, compared to where we were last week, we've almost quadrupled the number of deaths. The number of cases have skyrocketed. That's anxiety producing, right? That's scary. But let's put it in context, okay? This is not unexpected. What happened over the last week is well within our model, meaning, we kind of, based on the number of cases and catching up with testing and, especially in New York, in New York City, where they're really starting to get overwhelmed as far as hospital beds and staff. Unfortunately, we've kind of predicted the number of deaths going up. And like I said, as testing catches up, the number of cases going up. That doesn't make it okay. That doesn't make it feel good. But, what I don't want this information to have the power to provoke anxiety, more fear, and uncertainty in you. Just know that this is well within the model of what we expected. And this is something that we're going to talk about tonight. So moving forward, I want you guys to know, look, last week was tough. We're looking at another really rough week, okay? We're going to see more deaths this week. We're going to see cases continue to climb this week. But on the horizon, there is hope on the horizon because like those other statistics are within the models, right, that we are predicting the kind of course of this virus. What's also within the model coming up here is hopefully starting to flatten the curve. The reason things are going to get really bad this week is because in some of the stressed areas like New York, we're getting close to that apex, that peak of the curve, right? So we reach the peak and then hopefully see it flatten a little bit and then start to go down. And when I say the peak, I'm talking about number of cases, right? So we're expecting to climb to reach our maximum number of cases and then start to decrease, hopefully within the next week to 2 weeks. Now, one thing I expect to see, and I want you to keep this in mind because I don't want it to freak you out. We may see an increase in deaths despite there being a decrease in the number of new cases per day. Now, this is very important because the number of new cases per day is one of the metrics that we use to kind of assess where we are in battling this virus. What we want to see is the number of new cases per day to start to go down. And when we see that, that's a good indication to us that, hey, everything we've been doing has been for something, right? We're saving lives now. We're decreasing the burden on our hospital workers, and the ICU beds are becoming less burdened. and so when we start to see that curve flatten and go down, what I don't want you to be alarmed about is the fact that deaths will still be going up. And that's because deaths trail cases, meaning there's kind of a delay effect. One analogy I like to think about is water skiing, right? So the boat pulling the water skier is the number of cases, right? So the boat's going along straight, you're falling behind on your water ski. I've never water skied before, but it's California, so I figured I'd use a water sport analogy. You're water skiing behind, the boat turns, you're still going straight, and then you start to arc and follow the path of the boat. Well, if we think of the water skier as the number of deaths and the boat as the number of cases, the boat hopefully is going to take a turn, and we expect it to take a turn toward flattening and then decreasing the number of new cases per day. Deaths will continue to go up because it's trailing by a few days to a week. But what we should start to see is the deaths then follow the number of cases and start to flatten out. This is what we should expect to see over the next 10 to 14 days. But please brace yourselves this week. You know how the news is. You're going to get bombarded with, new cases, new deaths, really starting to ratchet up this week. And again, please check out my last video to help with kind of the mental health and the coping mechanisms with getting this news and continuing to feel isolated. I can tell you this will end. This will end. This is not the new way of life, okay? Don't let yourself get into that mentality. We will transition out of this and come out all the better on the other side if we choose to. So keep that in mind. So what I want to talk about tonight are some of the updates. Really important updates came out this week regarding masks and testing. So first of all, masks. Early on, my recommendation was if you're not a healthcare worker and you're not actively coughing or sneezing, you don't need a mask. And that was also the recommendation of the CDC. Well, as I also said early on, this is a brand new virus. So as more information comes out, as time goes by and we start to track the behavior of this virus more and more, we start to understand more about the infection it causes, recommendations can change. And hopefully they do change because that means we're updating things, we're learning more. So what we've learned is something that we suspected. We suspected airborne transmission. But what we weren't sure of is, how much can you transmit if you're not coughing or sneezing? It turns out this sucker is very contagious, and even just being next to somebody who's speaking and breathing, that's enough to kind of aerosolize this virus, meaning if you're less than 6 feet away, if you're all up in my grill, and we're talking, if I have active infection with this virus, I can transmit that virus to you. And keep in mind, part of the reason why this virus is so dangerous and has been allowed to get such a foothold on the world is because we can transmit without having any symptoms at all. So I hear a lot of, I don't think I had it, or I think I might have had it, or, I think I'm fine because I don't have any symptoms. Look, let me be very clear. You can have no symptoms whatsoever, or you can have minor, I have a little cough, I'm a little stopped up, I feel a little achy, to really, having a bad fever, sweats, really bad cough, and God forbid, needing to be hospitalized. That whole range is within the spectrum of this, the disease caused by this virus. So the fact that you have no symptoms doesn't mean you're not carrying it, doesn't mean you're not currently and actively infected, and that does not mean that you can't transmit it. So back to masks. Why do we need masks? 2 reasons. First of all, yes, if you're speaking in close proximity with someone and you have a mask on, and look, we've all had conversations with spitters. It's not fun, but now it can actually be dangerous. So large droplets, saliva, spit, yes, if you're wearing a mask, it's going to block that and catch it. It's not necessarily going to help you, completely be safe from breathing in the virus if you're in close proximity with someone who isn't wearing a mask. And that's the second reason to wear a mask. Protect those around you. Like I said, guys, we don't know if we have it or not. Luckily, and we're going to talk about testing next, luckily, we have testing available now, and I tested myself, and as of today, I do not have it, and I haven't been exposed. But that doesn't mean when I step out of the house tomorrow, when I go to clinic, that I cannot get exposed and potentially become positive. So keep that in mind. We'll come back to it. But as far as masks go, wearing the mask consider it a civic duty. Consider it your duty to protect those more vulnerable to terrible consequences of getting this disease, to getting this infection. And so if you're wearing a mask, you are holding in those air droplets from getting out. And let's assume you're a carrier, you're infected, until proven otherwise. If we go with that mentality, guys, I promise it will go leaps and bounds toward flattening this curve, stamping this virus out. So again, number one, yes, you may confer some benefit by wearing a mask to protect yourself, not the N95 mask, not the masks that are needed by our healthcare providers. Let's please leave those to the people who need them on the front lines, because if they start getting infected at a higher rate, if they start dying at a higher rate, we're gonna be in a lot of hot water. So let's leave those for the professionals. What we can wear are masks that are not N95. You can wear scarves. You can wear anything to cover your mouth so that you're not just freely breathing out air droplets, because every time we speak, laugh, or just breathing, we're breathing out moist air, right? And in those droplets could be the COVID-19 virus, right? And so to bring it all together, that's the reason why we recommend the 6-foot distancing, because unlike, say the 1918 Spanish flu, which would hang around in the air for hours, right? This COVID-19 forms heavier droplets. So as soon as it comes out of your mouth, it's sinking already. So that's why the distance of 6 feet is recommended, so that virus does not stay high enough, like around your mouth, nose level, to infect you. And instead, let's let it sink down to the ground. And on top of that, if you're wearing a mask, it never even makes it that far out. So we're protecting each other, and you're doing a great duty to the country, to your neighbors and your loved ones. So that is the update on masks. CDC, White House Task Force, is now recommending that if you're out in public areas, you wear a mask. For those 2 reasons, you don't have to wear it like around the house. You don't have to wear it, say, if you're going on a walk and you're all by yourself, but we still have to go to places like the grocery store and the bank. So if you're going to those public places where you may not be able to totally respect that 6-foot boundary at all times, wear a mask or wear a scarf, get creative, but wear something. Number 2, I want to update on testing. So like I said, very lucky. My clinic is now testing, and we're doing an antibody test, and we'll dive into that. But first, let's talk about testing. So there've been a lot of tests out there. There also have been a lot of fake tests, and a lot of tests that don't do us good as a country, as a community. And what do I mean by that? First of all, the fake tests. Unfortunately, these kind of disasters, these tragedies, as we know, brings out the best of people and the worst of people, and the best in people and the worst in people too, if we let it, right? So we have a lot of scumbags out there, unfortunately, guys. We know that. And so there have been reports of fake tests out there, getting tested, and, the test just being a total sham just to get your money. We've also heard of testing where it's not an FDA approved test. It might be a valid test, maybe, but we can't say unless it's an FDA approved test. And number 2, they're not reporting to the CDC. So let me put this into a scenario for you, and we can pull the important points from it, right? So let's say I'm, Joe Schmo. I go in off the street, I get a test, I get my nose swabbed and my throat swabbed, and they tell me, okay, we'll see you in 2 weeks. We'll have your results back. As soon as I walk out that door, if I'm interacting with people, if I'm going to the store, if I'm doing anything but isolating at home, the test is invalid. Why? Because I've exposed myself. I've taken the test, so stop in time right there. Then from there moving forward, I'm exposed again, right? So what do we need? We need a rapid test. We need something that either tells you on the spot or within 24 hours, right? Unless you're willing to take the test and then totally isolate until you get those test results. Not very realistic, challenging, not saying it can't be done, But for ease of testing results and flattening the curve, we need a rapid test and we need an accurate test. So that's number one. Number two, if in fact somebody's doing a test for you and they're not reporting to the CDC, what does that do? It gives us false numbers. So those numbers you see up on the news screen every day, that's because people that are taking the test and administering the test are reporting those numbers to the CDC so that we have more data. We know where the curve is growing. We know where it's flattening. So we know where to allocate resources. We know we can predict kind of where this virus is going. If we're not reporting to the CDC, we're not sharing that data with the rest of the country, it's selfish. It's selfish, So please, you don't have to come to my clinic to get tested, please. I mean, some of you guys are across the country. But if you are going to get tested, and you should be asking these questions, you should be calling your local public health entity. You should be calling your elected officials. Hold them accountable. Where is the testing? Because the more testing we do, the better understanding we have of who's infected and who's not. And I have to believe that if any of you had a positive test, you would absolutely follow the guideline of staying home so that you don't spread it to other people. Even if you have no symptoms, having the positive test tells us that you have it. You should isolate, and that way we flatten the curve. You can't spread it if you're isolating. Make sense? Good. So ask whoever is going to administer the test to you, or whoever is offering to administer the test, is this FDA approved? Are you reporting to the CDC? And can you show me how that's happening? Very important, guys. Don't be afraid to ask this. It's a very standard and simple question. And if in fact this test is legit, they should be able to provide that information to you. So those are the two important updates from this week, right? We're ramping up testing. Please be involved, be vocal, find out where you can get tested. Number one. Number two, if you are tested, look for a rapid test. You want hours to 24-hour turnaround, so that, just for that reason, because after you take the test, whatever you do after that could potentially expose you to the virus, and then your test kind of becomes invalid at that point. Make sure they're doing the necessary reporting. We talked about masks. That was the other big update. Wearing masks is now a recommendation by the CDC to protect you, yes, not completely, but to protect the rest of the community. That's what's most important, guys. On the last video, I talked about, how getting things and acquiring things will never make you happy, but, who you become can either make you very happy or very sad. This is part of that, right? Who are you going to become out of this? Let's let go of some selfishness and add in some selflessness. Wearing the mask when you're out, making sure you're getting the test by, that meets the criteria that we talked about. That's a huge step. That's a huge step towards doing the right thing. And everybody is needed right now. We need all hands on deck to stamp this infection out, okay? I'm Dr. Ford. I love hearing from you guys again. And thank you for watching this and giving your input and feedback. And I look forward to hearing from you soon. Be well.